Is scary sounding degenerative disc disease on MRI really a cause of your chronic back or neck pain? Well, let's find out. Degenerative disc disease is most common diagnosis of spine pain. And despite how common it is, the diagnosis of this degenerative disc disease is deceptive, confusing, and often misinterpreted. Misinterpreting pain as a degenerative disc disease can have several negative consequences. It can result in increasing fear, pain, disability, and excessive healthcare cost, and the treatments that may not be even effective or the one comes with the risk. Moreover, it can also hinder your ability to identify the underlying cause of your back pain or a neck pain. Well, there are many myths around this disease that leads to its misdiagnosis. So I would like to debunk 5 myths about the DDD or a degenerative disc disease that may make you question if this diagnosis was ever accurate to begin with. Sounds good? Hi, I am Dipti Patel, physical therapist with 20 plus years of experience, therapeutic pain specialist, and a yoga teacher. Don't forget to subscribe and click the bell so you get notified when my new video is released. Myth number 1, disc degenerative disease is a real disease. Many different diseases can cause chronic back or a neck pain. Few examples are multiple sclerosis, rheumatoid arthritis, Lyme disease, ankylosing spondylosis, etc. The diseases are typically characterized by a specific set of signs and symptoms which aid in their diagnosis using a predefined criteria. However, DDD does not have a clear diagnostic criteria. To tell you the truth, the criteria that are used to diagnose disc-related problems are ambiguous, they're inconsistent, and they rely on a questionable imaging findings on MRI. Well, the diagnosis of this disease is applied to a broad range of conditions varying from a minimum degenerative changes to the extensive damage that's shown in the MRI or an X-rays. Well, how do you diagnose this disease? You only look at the MRIs or X-ray results. They look at the disc abnormalities. They look at the mild disc loss, disc cracks, disc protrusions, excrusions, etc. That's it. There is no other criteria, but this happens naturally in the human body over time. They're just like wrinkles on inside. This begs the questions why we persist in labeling this common age-related adjustment as a disease. Without a clear set of diagnostic criteria, the diagnosis of the DDD will always be mislabeled. The myth number 2, the disc degeneration disease is caused by old age. Welcome to the human race. As you age, your spine deteriorates just like your skin wrinkles and your hair turns gray, right? We call them arthritis, which is nothing but wrinkles inside. But here is the real data, okay? So as you age, this is the graph I have, and in the graph on the bottom here, I have the age. So 10 years to 90 years of age. And up here, I have the pain. So 0 is no pain and 10 is the worst possible pain. So this first line right here that shows as you age, your spine's going to deteriorate. So this shows the degenerations. The straight line shows the degenerations. Would you agree? But when you look at the pain, complaints of pain in the people, it starts as early as age 10, but then it peaks between the age of 25 and 55, and then it drops. So why the disc degenerations keeps getting worse, but why the pain slows down, the complaints of pain slows down at age 55, right? So there is not much relations to the back pain, age, and the disc degenerations. That's what I want to prove here. Degenerative disc disease conditions are not only associated with the older populations, these changes are also seen in the young people, okay? A study of a young woman in their 20s found that 31% of women enrolled in the studies were living with the degenerative disc disease that progressively worsened throughout the study. And another study of the patients under the age of 21 also found the same. The degenerative disc disease does begin much earlier in the age. They saw that 76 people out of 1,877 young people included in the studies have a very early on degenerative disc disease. Okay, now let's look at the myth number 3. that the degenerative disease on MRI is causing all your back or neck pain. Well, disc degeneration usually gets diagnosed on an MRI or X-ray, right? But here's the thing. In 2015, Systemic Review reported just how common this degenerative changes are in individuals without pain. I repeat, without pain. 33 articles, 33, not a small number here, okay? Reporting imaging findings for 3,110 asymptomatic. Asymptomatic means people without any symptoms met the criteria for this study, and they saw that disc degenerations and the pain-free people increased 37% of 20 years of age to 96% on the 80 years old individuals. Disc bulges are seen in increased from 30% of those 20 years of age to 84% of those 80 years of age. The disc protrusion shown increased from 29% of those 20 years of age to 43% of those 80 years of age. So now the question is the disc degeneration shown on the MRI is the cause of all your pain? Well, think about this. Myth number 4, diagnosis of degenerative disc disease helps you to find the proper and effective treatment. Well, the question is how exactly the diagnosis of DDD is treated. How the treatments are different from degenerative disc disease compared to spinal stenosis, spondylolisthesis, spondylolysis, or a facet or a joint arthritis for back pain. There is no specific medications for this diagnosis, or there is a procedure out there to correct this. The majority of the time, the treatment for degenerative disc disease involves the pain medications, injections, procedures, surgery, just like other chronic pain conditions. And all of them just put the band-aid on your symptoms and provide you a temporary relief. Eventually, the pain returns, and that comes with the price. That's your side effects and the risk. Myth number 5, the degenerative disc disease is progressive and not curable. Well, you can slow down the process of degenerations by working on your mobility, core strengthening exercises. Sometimes those wear and tear don't matter much as long as you are function independently with less pain. Am I correct? The diagnosis of degenerative disc disease leads to more problems and prevents chronic pain sufferers from ever finding the root cause of the pain. This data should make us question the diagnosis of DDD or degenerative disc disease is truly caused, the pain truly caused by these changes on the MRIs, or those changes are just an incidental finding. Could you have a normally aging spine in pain caused by factors not seen on X-rays or MRI? Statistically, it's more likely that your persistent pain is related to the nervous system hypersensitivity than those degenerative changes. And while you can have both, the best approach will address those invisible changes that occurs in the nervous system, will improve your mobility and strength to focus on the function. I have designed a comprehensive 6 weeks program for chronic low back pain at the price of pretty much one massage and 2 co-pays that will teach you more about those hidden nervous system changes that contributes to a persistent pain conditions and will help you to improve your mobility, functions, and much more. The program goes in depth into the neuroscience of pain that addresses the nervous system, addresses the pain by nervous system retraining, strategies, and skills. If you want to learn more about the chronic low back pain, check out our therapeutic pain relief programs, the link in the descriptions below.